Hi mama, I get it. If you're watching this video at the end of the pregnancy and you're wondering why your labor has not started, I know it can be very challenging when you're close to your due date, or even if you're past your due date, waiting for the game to start. So in this video, we're going to see some mechanical methods that we can use to kickstart your labor. Let's start. Hello everyone, welcome back to my channel. Let's start with saying that our bodies, the female body, does not need any help to birth their babies. We are made to do that. Nature knows what to do, so our bodies know how to start this process. It's also true that some women will require what's called induction of labor for post-date pregnancy because their pregnancy has gone past the 42 weeks. And this is because we know that although very slightly, the risk of neonatal morbidity and mortality increases after 42 weeks. Therefore, an induction of labor might be suggested to you if that's your case. It's also true that in the past, when we did not have pharmacological means to induce labor, we had pregnancies lasting even 43, 44 weeks with no complication. Therefore, our bodies know what to do. That being said, we can still do something. We can still do things that are available to us in nature to help our body to go into labor. This video is linked with another video that I've done last week where I discussed the natural food or drinks that we can use to help our cervix soften, to dilate a little bit and potentially go into labor. So make sure that you got to see that one as well. I'll link it here. But then in this video, we're just going to discuss some other mechanical ways. Also, it's important to say that these methods, because they're so natural and harmful, they work best if they're combined with other methods. So it's very good that you know what kind of food or drinks can stimulate labor, and then you can add some of these mechanical methods as well to have the best benefits possible. If you don't know me already, my name is Ilenia. I'm a midwife. I currently live and work in the United Kingdom, where I work with women to make sure that they have the best pregnancy, labor and birth possible, and I've been doing so for the past 7 years. The first mechanical method we're going to discuss is, guess what? Exercise. Exercise is the best way to prepare your body to be healthy and fit and to give it the best chance to go into labor. You probably heard of people doing so many stairs in the last days of pregnancy, or maybe doing a deep clean of the house from top to bottom, and then miraculously going into labor the same night. This is because doing this form of physical activity can really help your baby engage in your pelvis, can really get your muscle relaxed and stretched, and therefore trigger your labor to start. You don't need to do that. There is no need to overdo it, but absolutely try to go for a walk every day, like 20-30 minutes a day. Go for a walk. You can put some music on, relax, and just enjoy the walk and the last days with your baby. This is going to really help you to relax and release hormones, positive hormones such as endorphins and oxytocin, at the same time help shift your pelvis and kind of shape it a bit better for your baby to engage. Remember that a baby that is positioned better in the pelvis with their head leaning properly against your cervix will facilitate the dilatation when the labor starts. So definitely worth a shot. If you don't like walking, you prefer, for example, swimming, that's absolutely great as well. You can also do the stairs, maybe sideways. You can go up and down holding the handrail, or one side first and then the other side first, or doing curb walking. Those things are all good to promote an asymmetry in your pelvis and therefore facilitate baby engagement. Another exercise that you can do in combination with all of these is using a birth ball. I don't know how many times I've said that, but like using a birth ball in pregnancy is so beneficial to promote a correct posture, to promote relaxation of the ligaments in the pelvis, to promote your baby engagement. So absolutely get onto that birth ball and do some bouncing and circles around it to promote your pelvis relaxation. The second mechanical way to promote the start of labor is actually having intercourses. Having sex is thought to help your pituitary gland to release oxytocin and endorphin, and this helps the kickstart of labor again. It promotes relaxation, especially through an orgasm. So together with all the cuddles and the kisses with your partner can really help to relax and promote the release of oxytocin. But not only, there is another reason why this method can work. In fact, having complete intercourses where the male releases sperm in the vagina is actually thought to kickstart labor, because semen contains prostaglandin, which is the pharmacological drug that is actually used to induce medically labor. So we don't have a clear scientific evidence behind it, but we think that this might trigger a bit labor to start again if your body is ready in that precise moment. I know that it can be a little bit uncomfortable at the end of the pregnancy having sex, but remember that what put baby in is also what is gonna get baby out, so something to consider. Another mechanical way that can help you trigger labor is nipple stimulation. In fact, stimulating your nipple is thought to release oxytocin, which again is the love hormone, the hormone that is going to help the contractions to start. So how do you do it? You, first of all, needs to be pleasant and enjoyable, so don't do it if it's painful, but you can just like rub your nipple and pull it gently. You can do 5 minutes each side for up to 25-30 minutes. You can also have your partner doing it if it makes you feel comfortable. Anything that will help to promote oxytocin flow. If you want to step it up a little bit, you can also do hand expressing of colostrum antenatally. I've done a full video about it, so make sure that you check it out here. It's very important to collect and harvest colostrum antenatally for 2 reasons. First of all, because it can induce your labor, it can trigger oxytocin. Second, because you're going to collect a little stash of colostrum that you can give to your baby after their birth. So definitely worth to try. Complementary therapy as well are worth a shot if you're trying to kickstart your labor in some way. For example, aromatherapy, massages, reflexology, acupuncture, they're all great way to release endorphins and oxytocin, and there is some sort of evidence based behind that says that using reflexology or aromatherapy can actually kickstart your labor. Make sure that you go to professional people that know how to treat you with your pregnant status. Otherwise, if you have no one in your area that can provide you the service, also you can have your partner do a massage for you, maybe with some essential oil. The one that really work well for triggering contractions are clary sage or rosemary. Always make sure that you ask your provider if you can use these oils according to your situation, and always do it after 37 weeks and if your baby is in the cephalic presentation. And don't do it if you have any particular problem during pregnancy, or if you have history of like precipitous labor or hemorrhage, or anything that really can prevent you to use these natural methods. But otherwise, a massage with just a normal oil or cream, it's definitely worth a shot because it can promote relaxation. Like, remember, in the final weeks of your pregnancy, you're really gonna be full of anxiety and fear because you don't know when the labor is gonna start. You can't plan it. You are so excited to meet your baby, at the same time you might be nervous about it. So all this fear, all this build-up of adrenaline can really stop the start of labor. So all these things, all these natural things that promote relaxation are worth to consider to put yourself into a mindset that will allow you to go into labor. For example, if you cannot use these services, you can have a warm bath or a massage, as I was saying, or doing some meditation or some yoga sessions. They're all good things to try that will promote your relaxation and the release of fear and tension. Last but not least, let's talk about the membrane sweep. I'm putting it in this video because it's a sort of a mechanical way to stimulate labor, although it's borderline with an induction method. But still, I think it's worth to mention, because it should not be offered to you before 40 weeks. But if you are past your due date, if you are 41 weeks and they offer you a membrane sweep, might be worth to consider, because it's always better to try that before a pharmacological induction. What is it if you don't know already? A membrane sweep is done by your midwife during a vaginal examination. It's done with your consent and only if they told you in advance that they're going to do this procedure. And it really consists in putting the operator fingers between the cervix and the water bag. This to separate the amniotic sac from your cervix. This will automatically release prostaglandins and therefore potentially kickstart your labor. It doesn't work every time, like it really works in 1-2 women every 8. Therefore, don't be disappointed if it doesn't work straight away. You might need to have a second sweep as well. But it's definitely helpful in effacing and softening your cervix anyway, so might be worth to consider. Always make sure that you know risks and benefits with this procedure, and again, you need to give your consent for it. Let me know if you tried any of these methods in this pregnancy or in the previous pregnancies. Let me know if maybe you combine them together, and let me know what worked for you. Don't forget to like the video and please subscribe to the channel, and I'll see you next video. Bye bye.